Okay, good. Hopefully everybody can hear me, and we're delighted that we've got some joining us tonight, so it's really great to see everybody. Bear with us a little bit tonight because there is a lot of people on this Zoom call, so hopefully we'll be able to get everybody in, everybody can hear us, and we won't have too many technical issues. So I'd just like to welcome everybody to this live webinar about the COVID-19 vaccination and fertility, pregnancy and breastfeeding, just so that everybody knows they're in the webinar. We're really pleased that you've been able to join us tonight, and we're really delighted that there is so many of you that have joined this call. I'm actually Pat Harris. I'm the strategic lead for the Independent Consumer Health Watch in Devon, Plymouth and Torbay. I'm the Chief Exec of Engaging Community Southwest, and I'm your chair for this evening. I'm joined tonight by Sue Wilkins, Director of the Mass Vaccination, Flu and Testing of University Hospital Plymouth, Charlotte Wilton, Acting Head of Midwifery and Head of Nursing for Women and Children's Services, Plymouth University Hospital, Tracy Nichols, Specialist Community Public Health Nurse and Health Visitor of Live Well Southwest, and Dr. Lee, Junior Doctor of University Hospital Plymouth NHS Trust. So welcome. Our panel will be giving you a brief about the COVID-19 vaccination, fertility, pregnancy and breastfeeding, and then there will be an opportunity for you to ask questions. So we would welcome people to save their questions to the end. If you hear something, write it down and you will get an opportunity, but with so many of you, we will do our best to make sure everybody gets a chance to raise any questions. Please be aware that this event is being filmed and will be published online and via social media so that other people can benefit from hearing the speakers and answers to your questions. If you do not wish to be seen or filmed, please keep your camera off. You can ask a question. I don't know if people are familiar with the chat room, but you can ask questions either by putting something in the chat bar, and we'll do our best to try and answer those questions, or by raising your hand on the Zoom call. If not, if you can do a wave, and we will do our best, but as I said, I can't see everybody, but hopefully the team that are working with us tonight will be able to let me know that you want to raise your question. If you raise your hand, and I will come to you in turn, as I said, and after the event, the attendees will be emailed any relevant links and information shared tonight. So hopefully that people understand all of that, and we're good to go. So before we start, we have a quick poll that we'd like to undertake, just really to see how many people have had their COVID vaccination and how many people feel confident if they haven't had it but are going to have it. So Jack's going to put a poll up for us. And if people can answer that. I think we're still loading up, Jack, are we?
Yeah, it's come up. It's people are just responding at the minute, so
let me know when you think we've got most of that.
Yeah, I will do.
So just to say, when we finish the poll, Jack will be putting some slides up, and our speakers will be talking through the slides. So hopefully everybody will get an opportunity to, if they can't hear so well, we'll be able to see equally what's been said. Okay, is that about it, Jack?
Yep. I'll put the slides up now for you.
Okay, thank you. Can you take the poll off, Jack, or was it? on my screen. That's just on my screen. Okay, so could you go to Sue Wilkins' slide, Jack, please? Okay, so Sue, can we start with you first?
Thanks ever so much indeed, Pat, and good evening to everyone. Thank you for joining us this evening. It's a really exciting time to be doing this presentation because we've done other evenings like this with different areas, different topics, and we've never been in the privileged position that we're in now, where we can invite absolutely anyone that wants a vaccine along for a vaccine. So previously we've either not been open to every cohort or we've not had enough vaccine, but we're now in this absolutely privileged position where anyone that wants a vaccine, any adult that wants a vaccine, can come along and get a vaccine, which means we're not having these kind of conversations and then asking people to look out for dates when they're able to join us. So a really exciting time to be talking to everyone this evening. And just as a little recap across Devon, we are in a really good position. So the number of people that have had vaccines, well over 75% have had both their first vaccine, and well over 50% have had both their vaccines, and that's comfortably over now. So exciting times we have with regards to finishing what back in December seemed like a mammoth task, an absolutely mammoth task, but we're getting there. And if we describe it as a marathon, we're somewhere sort of in that 24th, 25th mile now, I think. So talking about fertility, pregnancy and breastfeeding, we know, and the data shows us, that for women who are considering pregnancy, this is one of our highest groups who are unsure about having the vaccine. And we're not expecting tonight to be the only thing that you're taking into account. We're going to try and cover some of those big topics this evening. But our absolute encouragement is that you have a midwife, you have an obstetrician, please, you have a GP if you're not yet pregnant, please use those health professionals and talk about your individual circumstances to help you come up with your own decision about whether to be vaccinated or not. And of course, this evening you're going to hear us try and encourage you to be vaccinated, but we understand, particularly in these circumstances, quite what a major decision that is. So the slides this evening are just to set the scene really, and we hope we're going to have a really rich conversation after we put some slides up. And the slides are going to deal with what we think are perhaps the obvious questions. And I'm going to start right at that beginning bit with the fertility side of things. So there's an awful lot online, and I had a quick look earlier to see what's being said around how fertility could be affected by the COVID-19 vaccine. And it's easy for us to use a phrase, and this phrase, which I always think sounds a bit pompous, there's no biologically plausible mechanism by which current vaccines will impact on women's fertility, was actually the statement that came out from the Royal College of Obstetricians and Gynecologists. And I'm sure, you know, a big blanket statement like that, just because it's not biologically plausible, it doesn't mean we don't still have concerns. So what's the next bit after those concerns? Well, that's the research that's been undertaken that's looked at the impact of the vaccine on fertility in animal studies, and that started obviously now to move into humans. And if I could have the next slide please, Jack. What's really helpful with this is when we look at the impact on fertility and with the way that the vaccine works, we don't just have the information now for women that have been vaccinated, because the vaccine itself talks to the spike proteins. If I could just briefly explain that the vaccine doesn't work in a way that it gives you a small dose of the illness like some vaccines do. It works by giving the body an instruction about how to make the spike proteins. So that's the protein at the very end of the journey that causes the body to then attack the virus when it senses that the virus is there. So the vaccine itself basically encourages the body to generate the same antibody that you would if you actually had COVID-19. And we know that not everybody comes out of having COVID-19 with the antibodies, but most people do. So as well as that huge group of people that have been part of research trials looking at the impact on fertility with vaccine, we now also have that evidence supported by the number of women who have had COVID-19 and therefore have the presence of the antibodies and the spike protein and are still not having any fertility problems. So we've absolutely strengthened that knowledge base that we've got around fertility and vaccine. And the quote that you see there from Dr. Edward Morris, who is the president of the Royal College of Obstetricians and Gynecologists, and I just want to be clear that the Royal College have also joined with the Royal College of Midwives to support this statement, that they want to try and reassure women that there is no evidence. And the website, the Royal College of Obstetricians and Gynecologists website, has a really good question and answer session on it, which I would absolutely encourage everyone. And as I say, this is a part of a plethora of information that's available, but I would encourage people to find that really rich, good information, and you can't get an awful lot better than what the RCOG are bringing across. And I think it is worth saying that at one point, the Royal College was sceptical about vaccine in pregnancy, and have had the opportunity now to review all the evidence available and now have a really committed opinion that the vaccine is fine in pregnancy. And at this time, the vaccine is what we have available to us. So it is the best option we have for protecting people against disease. So if I could have the next slide, please, Jack. So if you're planning to become pregnant, is it wise to have the vaccine? Well, predictably, I'm going to say yes, and that's supported by the JCVI, which is the Joint Committee for Vaccination and Immunisation, and they are positively encouraging people to now, we've got every age cohort open, anyone who is planning a pregnancy, they're positively encouraging them to come forward and have the vaccine. And the bullet point there stating if you're in one of the groups offered the vaccine, as I said, that is now everyone over 18. So we're positively encouraging everyone to come forward. If I could have the next slide, please, Jack. And just to recap the situation with the different vaccines that are available. So the current advice is that non-pregnant individuals under the age of 40 should be offered an alternative to the AstraZeneca vaccine. And that isn't because that the very rare circumstance of the very unusual conditions that you'll have read about that are associated with AstraZeneca are more likely to happen when you're under 40, which is sometimes a bit of a misinterpretation. It is around the risk-benefit ratio. So anyone under 40 is absolutely now offered the Moderna or the Pfizer vaccine. And that would happen absolutely routinely when you attended any vaccination site. And for non-pregnant individuals over the age of 40, or those with underlying health conditions that make them more susceptible, the AstraZeneca is still there and available and is still being used. And for Devon now, in the main, that is people attending for their second vaccine, which I'll get to very shortly. Next slide, thanks. So the question, and since, if people might recall, at the outset of vaccination, there was this shorter period between vaccines, but now it's a longer period between vaccines. So this is a much more likely scenario. I'm currently trying to get pregnant. I've had my first dose, and should I delay pregnancy until after the second dose? Well, we know that a single dose of vaccine is a fantastic thing. It gives you really good protection, but we equally know that by having a second dose, not just does that protection go up slightly more, but also the longevity of the protection improves. So we would say, if possible, complete the course of vaccination before becoming pregnant, but it's really not a deal breaker. So if I could have the next slide, Jack. So if you find that you're pregnant after having had just one dose of the vaccine, it then becomes quite an individual decision about whether to move ahead and have the other one, or at least wait until after that first 12 weeks of pregnancy, that first trimester. And again, we would absolutely encourage a conversation with your doctor or your midwife, or using the decision tool that we've put the link to there. And that is because there will be multiple different circumstances, and one size, to use an over trite phrase, really doesn't fit all with regards to making these kind of decisions. So there is nothing to stop you having your vaccine earlier in pregnancy, and there is no advice that particularly encourages you not to have your vaccine earlier in pregnancy. But we know that quite a lot of people would probably opt to wait until after that first trimester for a second vaccine. And that wouldn't be a problem with regards to longer term immunity. But for some people, getting the immunity sooner might be the bigger priority than waiting. So we would really, and you'll probably hear it so many times this evening, encourage an individual conversation either with your midwife or your obstetrician to take you through that decision. And next slide, please. I'm going to move over to my colleague Charlotte. Thanks, Charlotte.
Thank you very much, Sue. So we're just going to look at around pregnancy and why is the guidance actually changed around vaccination for COVID. And so it's obviously changed based on the available data that we've collected since the vaccine rollout. There have been no specific safety concerns identified with any brand of COVID-19 vaccine in relation to pregnancy. However, in a minute, we're just going to talk around the preferred ones for pregnancy. So about 90,000 pregnant women worldwide have been vaccinated according to the real world data from the United States. And these are mainly women that have been vaccinated with the mRNA vaccine, so the Pfizer and the Moderna. And there haven't been any safety concerns raised around those vaccines. Next slide, please, Jack. Thank you. So based on this data, the Joint Committee for Vaccination and Immunisation advises that it's preferable for pregnant women to have either the Pfizer or the Moderna vaccines within the UK where available. There's no other research at the moment or evidence to suggest that the other vaccines are unsafe for pregnant women, but at this moment in time, more research is needed. So as more women have had the Pfizer and Moderna vaccines, that is what is being recommended. And the advice published by Public Health England's Green Book, so that's a professional guide for vaccinators in the UK, still advises that, you know, if you're pregnant, that you should be discussing the latest evidence with your clinician, so whether that's the GP, the obstetrician, or your midwife, around which vaccine you should receive. Next slide, please. So what happens if you find out you're pregnant after you've had the COVID-19 vaccination? Well, as Sue said in her slides, you know, you have a choice then around what you want to do. It might be that you've had the vaccine before you even found out you were pregnant, or had it unintentionally whilst you were pregnant. So we know that the success rates at that point are high, and that the risk of the baby at that point is very low. If you find out you've had you're pregnant after you've had one dose, then it's your choice then as to what you want to do, whether you go ahead and have the next dose at the recommended interval, whether you decide to wait until the pregnancy is over, or whether you actually decide to wait until after your 12 weeks, because we know the most crucial time for development of your baby is during that first 12 weeks. It's really important that you take into account your personal exposure to the risk of COVID, and also your actual risks yourself. So that's something that's going to be personal to each and every one of you. So that's really important, again, to discuss if you're before pregnant with potentially your GP, and during pregnancy, your midwife or your obstetrician. And the RCOG and the RCM decision tool, as Sue said, is really good at just trying to help you to decide and assist that decision. Next slide, please, Jack. So what should you do if you develop a reaction to the vaccine? Well, as with any medicine or any vaccine, often very common to have the mild side effects. They don't last very long. They're often limited to a day or two after the vaccine, and they're often very local. So the normal signs, the pain and tenderness in your arm, the headache, the tiredness, aches and chills. It might be that you experience flu-like symptoms, often like we do with any other vaccine, and you might have shivering or shaking for a day or two. Might be that you develop a bit of a fever, but that's okay. If fever's anything with a temperature over 38, just take a couple of paracetamol. We know that's more than safe in pregnancy, and just take that until your temperature subsides. But if you're concerned about your symptoms at any point, then it's really important that you consult your GP or maternity team. Next slide, please, Jack. So there have been reports that many of you will have heard about, and as Sue said, around the extremely rare clotting problem that they found with the Oxford AstraZeneca vaccine. There are some symptoms below that you can just see that if they happen anytime between 4 days after you've had the vaccine and 4 weeks, it's really important that you seek medical advice. You can see those listed below, but I'll just go through them. So that's a new or severe headache, which isn't helped by simple analgesia such as paracetamol, and it's getting worse. An unusual headache that when you're lying down or bending over is then accompanied by other symptoms such as blurred vision, nausea or vomiting, difficulty with your speech, weakness or drowsiness or seizures, new unexplained pinprick or bruising or bleeding, shortness of breath, chest pain, leg swelling or persistent abdominal pain. So just to reiterate, these are really, really rare side effects, but it's really important if after 4 days you were to get these sort of symptoms that you do actually seek further advice. Next slide, please. And this is over to Tracy, please.
Thank you, Charlotte. So we're going to now have a little bit of a look at receiving the COVID-19 vaccine whilst breastfeeding. So the information that we have today, which was published by the Joint Committee for Vaccine and Immunisations in December 2020, says that there's no known risk to giving available COVID vaccines to breastfeeding women. So we know if you are breastfeeding or you're expressing milk to feed your baby, you can have any of the 3 vaccines available, as long as you meet the other conditions for receiving the vaccines that have been set by the Joint Committee for Vaccine and Immunisation and the Medicines and Healthcare Product Regulatory Agency, the MHRA. So as with other vaccines that we have, there's no current evidence that anything other than antibodies passes into your breast milk. The antibodies are not harmful, and there's a small body of research to say that they may offer some protection against the vaccine, against having COVID. So all breastfeeding women will now be offered the vaccine at the time when it becomes available. So in terms of the safety data we've got for these specific vaccines, we know, as we've previously discussed, that there's no plausible mechanism for why any vaccine ingredient should pass through to your breast milk, and therefore you should not need to stop breastfeeding in order to have to be vaccinated against COVID-19. So Charlotte spoke a little bit on the previous slide about side effects. It's very plausible that you may well get some side effects, and therefore you may want to consider getting some support with somebody to help you to look after the baby in the days after you've had the vaccine. It's also worth considering having somebody around to help. You may also consider, if you're exclusively expressing, that you may want to express extra prior to having the vaccine, but however, remember afterwards you will still need to express as normal to keep that supply going and to stop you from suffering from any blocked ducts or mastitis or anything like that. Next slide, please.
Thank you, Tracy. Hello, my name is Eun Kyung Lee. I'm currently junior doctor working at University Hospital Plymouth NHS Trust. Thank you for joining us today. So I'm going to talk you through how to book your vaccine. So you can book your COVID-19 vaccination appointment online for an appointment at the vaccination center or pharmacy. If you cannot book appointments online, you can call 119 free of charge. You can speak to a translator if you need to. If you have difficulties communicating or hearing or are British Sign Language user, you can telephone 18001 119 or NHS 119 BSL interpreter service. For those individuals who aren't registered with a GP and can't book through the National Booking Service, you can book your COVID-19 vaccination appointments through the Vaccination Help Desk at the email address shown on the slide. Next slide, please. So in summary, the advice from the Joint Committee on Vaccination and Immunizations is that the COVID-19 vaccines should be offered to pregnant women at the same time as the rest of the population. And women may wish to discuss the benefit and the risk of this vaccine with the healthcare professionals. However, pregnant women can receive a COVID-19 vaccines even if they have not had a discussion with the healthcare professionals. You should not stop breastfeeding in order to be vaccinated against COVID-19. and women trying to become pregnant do not need to avoid pregnancy after vaccination, and there is no evidence to suggest that COVID-19 vaccines will affect the fertility. Thank you very much indeed.
Thank you. So we've heard a lot from our speakers tonight. Hopefully that's some information. I think we'll just have a quick look in the chat and see before we take questions from the audience. So I think, sorry Jack, I'm just trying to open up my questions. So one of the first questions was, should there have been, when you've had IVF, they were told that you shouldn't have vaccination, and this seems to be contradictory. Does somebody want to answer that one for the first question, please? Will somebody take that question?
Yeah, I'll pick that one up, Pat. That's absolutely fine. Thank you. So it's the fertility services aren't actually provided under the umbrella of University Hospitals Plymouth now. So it's quite hard to talk about the individual situation. I can absolutely reiterate and be confident that the information that we're giving is correct, that vaccine is fine through pregnancy. The only circumstance where further discussion is warranted, and it might be in this situation, is when there has been immunosuppressants used as part of the fertility program. It's incredibly rare that that happens, but that might be an individual conversation that's been had. So I wouldn't want to sweep those comments from fertility experts aside and say that there wasn't an evidence base to what they were saying, but it would definitely be worth a further conversation.
Okay, I think some of this was answered in the presentation, but we'll just double check. Are there any advantages delaying the vaccine until after any pregnancy has reached 12 weeks? And is it possible for a pregnant person to have the Pfizer or the Moderna vaccine?
I can come in there. As I said in the presentation around, it really is personal choice. We don't think there is any risk, but equally between up to 12 weeks, the embryo is developing and becoming a fetus from 12 weeks. So it might be that you decide to take that choice to delay. With regards to changing, if you've had the Oxford AstraZeneca first and then thinking about Pfizer or Moderna, the guidance that was actually published on the 7th of May, whilst advising that first choice should be Moderna or Pfizer, it equally says if you've already had the Oxford AstraZeneca, they would recommend that you remain with that and have that for your second dose.
Okay, and Helen asks, if she doesn't get vaccinated, do they need to cocoon from everybody until the baby is born? And will social distancing within a smaller bubble be suffice?
I'm happy to come in again. I think I would just say that if you decide not to have the vaccine, it'd be taking all the normal precautions. I know the guidance might have changed tonight with Boris Johnson talking about not needing a mask, but I think taking those precautions, good hand hygiene, trying to limit your contact with large groups of people would be advised.
Okay, if you decide not to have the vaccine during pregnancy, how long after the baby is born can the vaccination, and how easy will it be to access afterwards?
Thanks, Pat. Shall I come in there?
Yeah.
So with the announcement 2 weeks ago now about the booster programme, clearly it is going to be an essential that we have all the provision for vaccine still set up across the county. So vaccine will be absolutely available for everyone in nearly all of the existing sites that they're used to going and getting vaccine. And I noticed that inquiry comes from someone who's due in November. So will absolutely be available and easy to access ongoing through the winter, and we'd encourage people to come forward at whatever time so suits them. And as I said at the outset, now we can have a free offer to anyone, free not as in financially, but easy to access offer to anyone at any time. We'd encourage people to come forward whenever suits them. The other commitment that the large scale vaccination sites have made, as much as my colleague Jess was talking about going on and booking, is that we're absolutely respecting everybody who chooses to drop into one of the large scale vaccination sites now for their vaccine. So if someone was driving past Home Park, for example, and thought, actually I've now made the decision, you don't need to go and book, you can just attend and just rock on up and have your vaccine at a time that suits you. Please don't worry about anyone attending more often. We've got an amazing IT system now that totally enables us to see where everyone is at their vaccine programme.
Okay, I'll take a couple more off the chat and then I'll come out and see if anybody wants to ask anybody anything. I'm a breastfeeding counsellor with La Leche League, and some women are saying they are experiencing a drop in supply or change in baby behaviour, e.g. fussiness. Do you have any more info on this?
Yeah, so I can come in for that one, Pat. So anecdotally, there's been some talk about a drop in supply and some mastitis type symptoms. However, there's no reported adverse events. They're all very limited and we don't have any data on it at the minute. I help with the Plymouth Latch on site and haven't had anything come through there.
Okay. Is there any, I'm just going to flick through. I don't know if anybody's got their hand up anywhere. Can anybody see? Jack? If not, I'll continue.
I say most cameras are turned off, so I don't think there's, I can't see anybody now.
Okay, well,
no, I'm keeping an eye, Pat.
Okay, I'll continue through the chat then. I just didn't want to miss anybody if they haven't been able to put it into the chat. Okay. Is there any data research conducted regarding potential effects on baby following being vaccinated during pregnancy? I think some of that was covered.
Thanks, Pat. So there are two really significant research trials now that people who are pregnant can join, and the evidence is starting to become available for, and I think my colleagues will probably put those links into the chat for me, and the evidence is getting more and more prolific for vaccine during pregnancy. There is absolutely nothing at this stage that has come out to show that people who've been vaccinated through pregnancy have any adverse outcomes associated with that. But we're not going to lie that the evidence base isn't absolutely huge. It's a new vaccine and it's a new programme in the grand scheme of things, but there isn't any data at the moment to show that there are any concerns about being vaccinated during pregnancy. If people were considering vaccine during pregnancy, as much as I would say, as soon as you make the decision, go and get it done, we would really also benefit from people joining some of these research programmes looking specifically at vaccine in pregnancy, and we can put the links to those in the chat room.
Okay, great, thank you. Sophie says she's read that you should have the vaccine after 12 weeks, but before 28 weeks. She's 30 weeks. I have now missed the window. A question, has she missed the window? And why shouldn't they have the vaccine after 28 weeks?
I think Charlotte and I are going to fight to come in there. Okay.
You can both do a bit then.
Yeah. So none of that is diktat, and all of that is advice that is quite easy to find and read, really. So I think we've really covered the early pregnancy, that first trimester, where for all sorts of reasons we have historically encouraged people to be very sensitive about what they have, what they intake, whether that's even ingesting things during the early part of pregnancy. The window, so this after 28 weeks, what we call moving into the third trimester, comes about because this is the time of pregnancy when people are going to get the most dramatic effects if they were to get COVID. So it is not that it is too late to be vaccinated at that time. It is more that we would encourage people to have completed their programme of vaccination by that stage, so that at the part of pregnancy where they're going to be most likely most affected, if they do get COVID at that stage, they have full immunity by that point. So that's where this avoiding first trimester and avoiding last trimester comes from, but it's not that there's any problem with being vaccinated after that period of time.
Okay, Charlotte, did you have anything to add, or not?
No,
really?
I was going to go along that line and say that, you know, for half of women that are pregnant won't have any symptoms at all of COVID-19, but a few will become really unwell with it. And we know that one of the risks of COVID-19 in pregnancy is around premature birth. So having that vaccination before the 28 weeks is of huge benefit, but like Sue said, can continue all the way through.
Okay, lovely. Is there any data or research regarding potential effects on baby following being vaccinated during pregnancy? Where would anybody find any data or research?
I can come into that. So basically, there was an ARPO guideline that published the research on that, and they found that women who tested positive for COVID-19 around the time of the birth were twice as likely to have a stillbirth. So it was 8.5 in every 1,000 births compared with 3.4 in every 1,000 births. And it was also twice as likely for premature birth as well.
Okay, thank you. One from Sam. No, it's probably too early to say, but will the vaccine have any effect on baby in years to come? And that's a lot of people's concerns.
And we can understand that concern. It's without wanting to be remotely patronising, it's such a precious time, and you are so hypersensitive and thinking about all of those things quite rightly. And none of us can say never, but what we can say is there is absolutely no evidence, and not just no evidence, but no logic that we can think of by the way that this vaccine works that would mean that it crossed into the uterus and caused problems with a growing fetus that would then ultimately have problems on an infant and a child in years to come. So no evidence at this time, and no logical reason that we can think about the way that the vaccine works and how the vaccine literally is just talking to a protein that would then cause a problem for a growing fetus. But please don't think we're saying that without a total understanding of why people would be concerned.
Okay. Another question, you've referred to speaking about referring to medical professionals multiple times that you need to talk with, but a lot of people are saying that they're getting contradicting advice from midwives not to get the vaccine, and the GP advising that we should get the vaccine. This is incredibly confusing and contradictory. Please, could you advise why there is confusing information?
I'm happy to come in there as well as, so I was going to say from a midwife and from a midwifery point of view, I think, thank you for raising that. I think that's really important that we know that. Obviously, we cover 600 square miles at Plymouth with midwives working out of multiple bases, and we need to make sure that we're actually ensuring that they have the most up-to-date data. So that is absolutely an action that I'll take away from this and make sure that we ensure that they are up to date with the advice that we would be giving.
Yeah, there's another one there. Charlotte said that there is a confusion between what the midwife tells you and what the GP, so who do they listen to? So I think some reassurance there would be good.
That's really, can I just come in there, Pat? I mean, that's really helpful to have that information, because that's the first time that I'm seeing that, and clearly we're seeing it multiply. So that is really helpful to have, not just looking at it from a Plymouth point of view, but all of the hospitals in Devon connect into the LMNS, which is the local maternity and neonatal system, and we'll take the feedback from tonight through the LMNS and make sure that they're getting out quite clearly, which will be a total cross Devon, that the advice is exactly as the GP is stating within that. And I know Charlotte, as the head of services at Plymouth, will talk with her colleagues who work at the other trusts across Devon to check that we're really taking that forward. So thank you for letting us know.
Okay, another question is, are there any additional factors to take into consideration when considering IVF, when people are pregnant via IVF, sorry? What's the additional factors that people might need to consider?
Thanks, Pat. So the advice, as I say, unless for a very small group of women who have to have an additional therapy that involves immunosuppressants, the advice is that IVF is no different to getting pregnant in any other way. We would absolutely encourage people to have the vaccine. And I've taken clearly on board the feedback that we've also had about a little bit of contradictory advice there. And I will, in the most supportive of ways, just check that my colleagues who work in fertility services, which unfortunately don't necessarily sit under the direct NHS umbrella anymore. I'll just make sure that they've got the most up-to-date advice, because the advice has changed. So we just want to make sure in a supportive way that our colleagues are all with the most up-to-date information.
Okay, that's great. Is there any evidence that backs the idea of passive immunity with the mother to the child? If spike protein antibodies and immunoglobulins are passed through the mother's breast milk, would the child then require COVID-19 vaccination in the future?
So I'll come in for that one. So there's a very, very small recent body of research that shows that of mums that are breastfeeding that have had the COVID-19 vaccination, that the antibodies from that have gone through into the breast milk. That's very, very new data. It's a very, very small body of data, and we don't know how long, if that gives the baby any immunity and how long that would last for. And we also at the moment don't have any data on if and when children will be vaccinated against COVID-19, whether that will be required.
Okay, that's great. Thank you. Sarah says, with the recent data coming out suggesting change to menstrual cycle, hormones following COVID vaccination, is there any information on whether this will affect the hormones of those who are already pregnant?
Yeah, that's a very interesting topic, and actually there is on our oracle of research and evidence that's available to us. There's just been some additional information that's come up this week that's shown that from the small research studies that are happening thus far, they cannot see any link on, as much as there are reported cases, on the impact on menstrual cycles with vaccine. However, that is not disputing that there is an impact on menstrual cycle, but it's hard differentiating whether that is associated with vaccine or associated just with the fact that we're living in a pandemic at the moment and there's so much uncertainty. And of course, all of those things would equally impact. Now, for the Moderna vaccine, there was some reference to the fact that they were going to start noting within their side effects, so within any medication you get, you know that there'll be a list of side effects, that there is an absolute remote possibility, so one of the rarest, that menstrual cycle was to be affected. But Moderna have very recently come back and said they're now not putting that information in based on the evidence that's become available. So they are convinced enough now that the changes that they were going to make to their information leaflet saying it could impact on your menstrual cycle, they've decided to not run with. So interesting that we're already starting to get some of these totally different strands of research that are coming out. I've certainly heard anecdotally from friends and colleagues about impacts on menstrual cycles, and I'm sure we probably all have, but there doesn't appear at the moment to be any research that's supporting that.
Okay, thank you, Sue. Secondly, there's evidence of an immune storm following vaccine, and some are concerns about this affecting the placenta. Do you have any further information on that? Any of the panel want to take that question? Or is that something you want to?
I can come into that, I think.
Thank you.
I think there is limited research in supporting hypothesis as that, and I just believe that there is some misunderstanding at the public levels. So the spike protein they are talking about is synthetase 1, and this protein is important for growth and attachment of the placenta through the pregnancy. There is a misunderstanding that the COVID vaccine 19 antibody is against this spike protein, but I just want to reassure that these spike proteins, two of them are distinctively different. So I just want to clear out their misunderstanding information from the fertility point of view.
Okay, thank you, Ian. Should we have to wait until have the vaccine if we've recently had the flu or whooping cough vaccine?
So these aren't live vaccines. As we would hope that all women in pregnancy during the flu season running from obviously between September and February. Obviously whooping cough is 12 months of the year that we would be, advising women to have that. And then obviously COVID over the course of the pregnancy as well. So no, absolutely, you're able to have them, and we would recommend that you get them all.
Okay, and Helen's asked again, is a pregnant woman at a lower risk of contracting COVID if a bubble of contacts are fully vaccinated, while obviously maintaining social distancing and hand washing, etc.?
So I think Charlotte spoke before about limiting risk, but there remains no definitive reassurance we can give that people who've been vaccinated do not carry the virus. So just because people have been vaccinated, it doesn't mean they're not capable of bringing a virus into the bubble. So, of course, if someone makes a conscious decision not to have the vaccine, we would absolutely encourage everything that Charlotte spoke about earlier with minimising that risk. But we could not sit here and say that risk was even more minimised by only associated with people who've had 2 doses of vaccine.
Okay, thank you. Melanie asks, I understand that the vaccine cannot give you the COVID and that the mRNA is not thought to affect the baby in the womb. What about the other ingredients that are present in the vaccine?
It sounds a bit like I'm a stuck record, keep coming back to the evidence, but that's what we've got available to us. And thank you for understanding the link with the mRNA and how that wouldn't cross the womb into the womb and through the blood supply. But the other ingredients are, as with all vaccines, generally just carrying agents, and there is nothing within it that has caused the JCVI to say that there are any concerns for anyone having it during pregnancy. If there is a particular ingredient that's playing on somebody's mind, and I can access for them a pharmacological response to their question, please get directly in touch with me and I will ask one of my pharmacology colleagues to answer that, because I wouldn't want to just fob off with a general answer if someone's got something within those ingredients that are particularly playing on their mind. So I can certainly get a more detailed response to that query.
Okay, one more question, then we'll go to another poll. I've actually heard this quite a few times myself. I've had 1 dose but don't take the second. Do I need to restart the vaccine after baby is born?
No, is the simple answer, but there would be quite a lot of variables that are associated with that, particularly as we start getting into the booster programme. So depending how long it is, whether we've moved into booster cycles, who's having boosters. So the simple answer is no, you wouldn't need to start again, particularly if you had it at some point during your pregnancy and you're within a reasonable period of time. But as we start looking at booster programmes and what they're going to look like, it might be that there needs to be an individual conversation to be had.
Okay, one more question there is, can you provide the links to early indication that there's no risk to baby following the birth? And I agree with the earlier comments, data and guidance seem to all relate to the pregnant women, not the baby following birth.
Yeah, I think my colleagues earlier put the link to the RCOG website on the chat, which has certainly got the links to the evidence that's there, and we can add further to that with some other links to the evidence.
Okay, that's great. Any more questions from anybody? I think Jack's just going to put up another poll. So listening to what you've been hearing tonight, we just like to ask people the question, if Jack can put the poll up, about if people would feel more confident about having the vaccine now. And has the information, the panel have taken some really good questions and been great to hear their response. And we hope we've managed to capture everybody's questions that they raised. There is one there while we're just doing the poll is, can people find out where the ingredients are, what the ingredients are in the vaccines?
I've literally just done that as a Google, and it's very easy to find. It takes you actually to the manufacturer's individual lists if you Google it. So I'm sure my Clever Comms colleagues will put that in the link as well.
Okay, and it's great to see on the poll that 82% of you have found the information useful tonight. That's really good to know. And like I said, we've had a great panel that have been able to answer your questions very promptly as well. Has anybody got any other questions? Is there anybody that hasn't put anything in the chat? Jean, I can't see anybody that we might have missed.
No, I don't think so, Pat.
No. Okay, well, I'd like to thank everybody for attending tonight. It's been great, probably one of the most quietest audience I've had, but a great thank you to the panel for the information. Jack's just sharing out the poll results. So hopefully everybody can see that. But I'd like to thank everybody. And I'm sure if anybody's got any questions and you need to follow anything up, then I'm sure we can arrange for that to happen as well, if anybody didn't want to share their question on the screen. So thank you, everybody, and I really appreciate you attending tonight. Thank you.